Hi, I'm Dr. Nancy Lonsdorf, Johns Hopkins trained integrative physician, founder of My Ageless Brain, and author of The Healthy Brain Solution for Women Over 40. I'm super excited to share with you today some research that I came across this past week that verifies and validates the ancient Ayurvedic practice of oil massage called Abhyanga. Abhyanga means making all of the limbs and parts of the body auspicious. And it says that doing this practice regularly, meaning ideally every day or at least a few times a week, can really help to reduce the effects of aging on the body, not only on the skin, but on the whole body. And this research that I just came across is amazingly validating of this 5,000-year-old practice. How did those ancient Ayurvedic doctors know that this is so healthy for you? So I wanted to share with you the research that I came across, and I will share my screen and show you what I discovered. So what we have here is we see that the skin actually is connected to the joints, and this emollient person with youthful and flexible joints jumping for joy in the upper left corner, and up the right corner we have a beautiful healthy looking brain. And how possibly could the skin be connected to the health of both of these organs? Now, if you know Ayurveda or you are a holistic medicine buff, you will say, of course they're connected. Every cell in the body is connected to every other cell. We can't look at the body as just a collection of parts. We have to look at it as an interconnected whole. So let's see what this study found. The title of the first of the two studies I'll share with you is Topical Applications of an Emollient, meaning an oily substance, a fatty substance, reduce circulating pro-inflammatory cytokine levels in chronically aged humans, a pilot clinical study. So in other words, they took older adults and they applied emollients to the skin, and they then checked what happened with the markers of inflammation in the blood. And we know they chose chronically aged humans in nursing homes because aged humans tend to have higher levels of inflammation. It tends to go up as we get older, but what this study is going to imply is maybe it doesn't have to. So what they found was that by applying this emollient on the skin every day to the elderly patients in this group, and they did it for 30 days, and they applied it twice a day. And what they found was that the inflammatory markers in the skin dramatically dropped in the group getting the oil or the oily substance applied to their bodily skin twice a day in just 30 days. It was very remarkable. And in fact, they had a control group of 11 young people, and they found that the levels of inflammation of these key markers of immune activity became equal to those of the young people after only 30 days. So talk about anti-aging and even reversal of aging. So that alone is great because we know that inflammation rising in the body, especially as we get older, is associated with osteoporosis, atherosclerosis, meaning strokes and heart attacks. It's associated with diabetes, and maybe most frightening of all, it's associated with increased Alzheimer's disease. So let's look at another study. Now, this study follows up basically on the idea that applying this emollient to the skin of older people reduces inflammation. So that being demonstrated, they wanted to see if they could find one of these downstream consequences of chronic inflammation, such as cognitive decline. Well, would that actually be helped by doing this application of the emollient? So here we go. They studied in this study 200 elderly patients in nursing homes. They were over 65 years old, and they applied this emollient regularly for 3 years and followed the results. And what they found, I will share with you in the next slide. And they randomized it, actually. They took those patients, 200, and they randomized them to either no emollient to the skin or emollient to the skin. And they followed them for 3 years, which is a good amount of time. So what they found was that in those who were untreated that did not get the emollient applied, over there on the right, you'll see a big red bar. Those people continue to lose water and have damage to the epidermis, meaning the outer layer of the skin, as those 3 years went by. In other words, they continued to age and their skin continued to break down in microscopic ways, not necessarily even any evidence of inflammation. But in those who had the emollient applied, they actually had improved skin function, and they did not lose that water through the skin, meaning the skin had greater, more youthful integrity. So in other words, what we're saying is it actually does affect skin. And skin loss of hydration, meaning dryness and micro cracks probably in the skin, is associated directly with increased inflammation in the body. So we know that helping the skin can actually help reduce inflammation. And we saw that in that first study we looked at. But really interestingly, here they replicated similar results. Here we see that the group that was treated with the emollient, they had reduction in their levels of C-reactive protein, a measure of blood inflammation, and the interleukin-6, and no change in the tumor necrosis factor alpha in this group, unlike the other group. But you'll see that those who did not get the emollient over 3 years, they had increases in these inflammatory markers, all of them, including TNF alpha. But here comes the really amazing result. The effect of the emollient application regularly over 3 years to these elderly people resulted in a stabilization of their cognition, as measured by the Global Deterioration GDS scale. That is very remarkable. Those who did not get the emollient actually deteriorated. They declined 3 points on that scale. So their cognition continued to get worse, whereas the other group getting the emollient, simply getting the emollient, did not lose cognitive function. So that is a remarkable result that I wanted to share with you, because if you are over the age, just a moment here, I'm going to stop sharing if I can. That is such a remarkable result that I wanted to share that with you. And if you are over the age of 50, when this skin breakdown starts to happen and the skin gets drier and that drives inflammation up in the body, I wanted you to know about this so you can start to either apply this particular brand of emollient if you prefer to use exactly what was in the study. It was called Atopalm, Atopalm, and it has equal amounts of 3 fatty acids, cholesterol, free fatty acids, and ceramides. And those have been known to help the skin. So it does have some other kind of chemical sounding things, but it does not have parabens and it does not have phthalates. So you can rest easy about that. But I wanted to share with you the Ayurvedic way, and that's what I do and many of my patients do or have done throughout their lives. And that is use a vegetable oil for your massage. And the traditional vegetable oil to use is sesame oil. And this is said in Ayurveda to be the most potent and best for the skin and overall body for massage. And indeed, research on sesame oil shows that it has strong, potent anti-inflammatory properties, and not only for the skin, but potentially for the joints. And I have had patients who have had chronic back pain or joint pain, and they have started to do this oil massage as often as they can, at least 1, 2, 3 times a week, if not daily. And they have reported to me that they no longer get back pain. And that back pain could have been pretty serious. One of my patients would be laid up for days every few months. And that stopped happening as soon as he started to do the oil massage. So I wanted to tell you about that. Now, if you have very sensitive skin that may be prone to rashes easily, especially if you're a younger person, it's a time of life your skin might be more prone to rashes, then you may do best with this product, which is coconut oil. This is an organic coconut oil, and this is a refined coconut oil so that it has some of the natural smell and odor, delicious odor of coconut is gone, but it is the least likely to cause any irritation in your skin. And coconut oil, of course, is solid at room temperature unless you're in a very warm climate, in which it's liquid. So you might want to melt it gently over some heat on the stove or in a little crock pot or however you like to do it before you apply it. And then we have one other, the ubiquitous, I hope it's ubiquitous, I hope you have it in your kitchen, olive oil. This is my favorite oil in the world because I think it's suitable for almost anyone, both internally as well as on the skin. And this is an extra virgin organic olive oil. So you might choose to pick any of those oils, as well as there are beautiful oils that you can get at mapi.com. And you can use those herbalized oils as well. So I wanted to give you a couple tips about doing this oil massage, but in the link below, you can link over to a page where you can access my instructions on how to do this oil massage at home. Would love for you to download that instruction sheet and begin this oil massage. So just a couple tips off the top. You do this oil massage with the flat of your hands, and there are special strokes over the joints. You do circles like that, and over the long parts, you go up and down, and you cover the back, the sides, the top, and then you do circles here, and then let's say your arm, you do sideways, long, along the long bones, and then circle over the wrist, and then you pull off the fingers. So that's a little demo. You start from the top of the body, you do your head if you can. It's especially coconut oil is a wonderful moisturizer for the hair. And you can use that on your head. It's very cooling and supports good sleep. One other tip, I can tell you these oils are amazing. You can, before bed, apply a little to the bottom of your feet, the top of your head. If you're having trouble sleeping, believe it or not, it actually calms your mind and brain. And research on sesame oil has been shown also to be very protective of the nerves. And people suffering from neuropathy, sesame oil massage can be helpful. I've had patients with pre-diabetic neuropathy, and they have improved with organic sesame oil massage to their feet from a very painful state to a state where they basically weren't experiencing pain anymore. Now, they also had some specialized oils, and those are available if you check them out at mapi.com as well. So I hope you've enjoyed this. I hope that you will implement at least, if you're a young person, at least once a week. It's going to help to preserve your skin. If you're over 50, I highly recommend at least 2, 3 times a week. You make this daily oil massage a habit. If you are over 65, if you feel like you are at risk or starting to lose your memory or have any kind of inflammation problems, I highly recommend you do this every day. And again, you can use Atopalm, Atopalm, if you want to use the exact combination of lipids, fats that were used in these studies. So I hope you find that helpful. I wish you the best of health, and join me again for our next episode. And don't forget to click the link below and go grab your instruction sheet. All right, take care. Bye for now.